Hello, everyone, and welcome to the third day and the last day of Level Up to Health Coach Summit. It's been a great 2 days and day three of the summit. I've enjoyed the feedback and the comments from all you participants, so thank you and keep them coming. For those who may be joining for the first time, this has been a 3-day summit with us, approved for 4 hours of CE credits for CHES and MCHES folks, as well as those who are board certified in health and wellness coaching and certified in public health professionals. You can certainly visit the course registration page or the summit registration page, and you'll find the links on how to claim your CEs. Try and get them in, as the links will be disappearing shortly after the summit by midnight tonight. We may extend it by a couple of hours, just based on the timing where people are located, but just try and get your CEs in as soon as possible. Some housekeeping things. Again, this has been a series of pre-recorded interviews, so there is no live chat on the summit. If you have any questions, please feel free to send us an email or put it in the comment section on the course registration page, and we'll get to them as soon as we can, and definitely before the summit is over or within the next couple of days, you'll get a response from us. So we have a few more speakers lined up for tonight. I promise you they have lots of information to share, lots to unpack, so definitely stay tuned for most of the summit. For a great portion of it for tonight. We will have one of the healthcare attorneys, Marguiles, speaking to us, as well as Ms. Teri Elkins from Diabetes Prevention Program up in Arizona. So very thrilled to have them and good speaking to them, and hope you enjoy the summit. Okay, for this session, we have a very special guest with us, Mr. Russ Marguiles. He is a healthcare attorney in Washington, D.C., and works with innovative companies, specializes in reimbursement and Medicare, Medicaid. So we'll talk to him today about all those questions we have in mind. So I'll turn it over to him to get us started.
Great. Well, it's really nice to be here, Chinelo. Thank you for having me. I'm a big fan of health coaches and health educators and the role that allied health professionals can play in really modernizing our healthcare system. And this is an exciting time to be having this conversation, because we're really beginning to see some movement, particularly when it comes to not just having health coaches and health educators as background participants, but really as active participants. And I think the piece we're going to talk about today here, Chinelo, is the role that payers are starting to recognize for health educators and health and wellness coaches. Just a little bit about myself. So I'm a partner in the healthcare practice at the law firm Foley Hoag. We have offices in Boston, New York, and Washington, D.C. And I focus generally on Medicare and Medicaid coverage and reimbursement issues. And that with clients really spanning the healthcare spectrum. So I represent providers, I represent payers, but I also have had the opportunity to represent health coaches and health coaching practices and physician practices looking to integrate health coaches and talk to them about sort of what the current limits are, what currently is available to them in terms of coding, coverage, reimbursement. And I think perhaps in the most exciting piece is really talking about what's coming down the pike. Because with the growth of remote patient monitoring, telehealth. Some of this has been spurred certainly by the COVID-19 pandemic and the temporary restrictions on the use of telehealth. There is an increasing recognition from payers that allied health professionals, which I would include health coaches and health educators, can really play a critical role in enhancing patient care, improving patient outcomes, and lowering overall healthcare costs.
Now, what are some of those things that payers are recognizing when it comes to integrating health coaches? What are some of the functions that a health educator or health coach can do and possibly, help the practice bring revenue and things of that nature?
Great. So, most of the work I do, Chinelo, is based around federal healthcare programs, so around Medicare and Medicaid. I will say, from the work I do with commercial payers, employer plans, I think there is far more innovation and flexibility coming from that side right now. And that's largely because Medicare and Medicaid are both defined benefit programs and are based in longstanding statutes that and I'll say this is particularly true for Medicare. Medicaid we'll put to the side for a second because Medicaid gets complicated because it's really 50 different insurers. But for Medicare, traditionally, the only individual in a physician practice that could bill for a service was the physician himself. Now that has obviously over the years relaxed to some degree. We now have physician assistants, we have nurse practitioners, we have nurses, we have a whole host of individuals that are integrated into practices that both provide services under the direction of the physician, but also bill independently. We are not really at a point yet in Medicare where health and wellness coaches or health educators are capable of billing independently to Medicare. And so typically the model, I see most often is where these health and wellness coaches and health educators are integrated into a physician model where they are providing services. The Medicare term would be under the supervision of a physician. So just to give you a couple of examples. So for example, in Medicare, there's a benefit known as the annual wellness visit. This is something that every Medicare beneficiary is entitled to receive a set of services each year. And the statute is very clear that at the very least, health educators, and we would argue probably health coaches, can work under the supervision of a physician to provide those services. So while it isn't necessarily, at least in Medicare context, the health educator or the health and wellness coach billing Medicare directly, they are certainly able to, as either auxiliary personnel or clinical staff, and those are two technical terms in the Medicare program, provide a whole range of services under the roof of a physician's office. So we're seeing a real growth there. I think there is a hope that we'll get to a point one day where there's a recognition that health and wellness coaches should have independent billing authority. And we've certainly seen that, there are now codes available. Those codes, unfortunately, aren't payable by Medicare. But we're seeing a trend there. The last piece I'll note is that with the growth of telehealth and remote patient monitoring, the roles that health educators and health and wellness coaches can play has grown even more. And so there's even more services that really make sense for these type of allied health professionals to provide. Last piece, and then I'll turn it back over to you, Chinelo. Commercial payers are not bound by Medicare's rules and have taken some additional steps to incorporate health and wellness coaches and health educators into practice. They could adopt different rules about whether or not they can directly bill. They can enter into specific arrangements. They're, I think, more interested right now in the role of health coaches and providing direct services. So we're seeing a little more innovation on the commercial side, but certainly things seem to be going in the direction of a recognition that these are really vital services.
Now, for example, from the commercial aspect of things, have you seen them, let's say, require a particular certification or training or list certain ways that the health educator or coach needs to be trained in order for them to be incorporated into the modules? For like example, with the diabetes DSME, they require at least somebody, if it's a pharmacist doing it, that person should have been trained in diabetes management, even though they're not necessarily the billing provider, but at least be able to document that the pharmacist or CDE there, well, of course, the CDE will be licensed, but they're bringing on board is fully trained to do that role. Have you
Yeah,
seen?
there's a couple of interesting dynamics at play there. One is that I think both payers, whether federal government payers or private payers, are reluctant to point to one specific certification as the necessary certification. But I agree with you that they are increasingly looking to a set of competencies that they view as important. The other piece that comes into play there is that health educators and health and wellness coaches are not licensed. And nor is there really an anticipation that they will become licensed as states begin to sort of move away in some senses from licensing all types of allied health professionals. That in some cases can create barriers to coverage because in many cases there is an assumption that most healthcare providers are licensed and regulated by a state. And so you may see language that says, this service can be provided by any licensed healthcare practitioner. Well, health educators, health and wellness coaches are not licensed healthcare practitioners. And so we see that as a barrier that comes up every now and again. And that's one thing I've been doing is trying to engage directly with the Centers for Medicare and Medicaid Services to explain that barrier. And I think we're continuing to seek greater clarification and also recognition directly from the agency that not all providers are licensed providers.
Now, from like the innovation side, I've seen companies like Vita Health or Omada Health come out, and I recently was reading this article where Humana in Kentucky contracted with Vita Health to do diabetes management. So how does reimbursement from like a startup perspective, are you able to speak on that a little bit?
I can speak to it. So I haven't been involved in those particular arrangements, but I'll note a couple of things. One, unfortunately, those aren't happening yet in Medicare and probably not happening in Medicaid. I can't speak for every single state Medicaid program. But although there are some interesting, so there's this whole very exciting realm of both digital health and digital therapeutics that is growing and is capable of putting the health educator or the health coach directly face-to-face with a patient. And I think there's some really neat data coming out of those types of arrangements. So by and large, those are not being paid by federal healthcare payers, but can be negotiated. I mean, anything can be a negotiation with a commercial payer. And so I think there are some commercial payers, particularly that are interested in seeing cost savings data, where they would pay or enter into an agreement. I think most of those arrangements I'd see tend to be on a per member per month type of basis, where the contract oftentimes would be between a health plan and the health coaching app, let's say, and the health coaching app makes its services available to the members of a health plan for X dollars per member per month. And I think that's a growing field in the commercial and employer market, given the growth of really innovative models out there to bring health coaches and health educators in a variety of disease spaces, right? I've seen it in diabetes, I've seen it in weight loss, and there's obviously significant cost savings that could be accrued there. So payers seem to be interested.
I'm glad you mentioned the dollars per member per plan, because I've seen a lot of concierge models come up, and that's one place that heavily does have health coaching, because they offer health coaching services to their member. But it's like an interesting model because, of course, they're going to hire the health coach or the health educator to do those coaching services, but they're not really paid for by any insurance, because concierge medicine is self-pay and things of that nature. But another aspect that I find interesting is the Medicare Advantage piece of things, and that space, and a lot of things can be done in a Medicare Advantage plan or arena. Can you speak a little bit about your experience with those plans as well?
I can, yeah. Medicare Advantage, for the listeners that don't know, Medicare Advantage is the general Medicare benefit, but it's administered and run by private health insurance plans. So United Healthcare, Aetna, Cigna all have Medicare Advantage plans. They are Medicare. It is the Medicare benefit, but the model essentially is that the plan receives a set reimbursement amount from the federal government every month to manage each patient's care, and it's a managed care type of model. So the benefit of that for the topic we're talking about is that Medicare Advantage plans are not necessarily tied to the same rules that would normally apply in the Medicare space, right? So they're not tied by the normal billing rules. They're not tied to the same source of codes in all respects. I'll speak to one particular area that I think is of interest to health coaches and health educators, which is in recent years, Medicare Advantage, or rather the Centers for Medicare and Medicaid Services has loosened the rules around the types of what we'll call supplemental benefits that Medicare Advantage plans can offer. So these are benefits that don't fall into the traditional statutorily defined benefit categories of Medicare, but can still fall under the medical benefit. So, the general rule is that these services need to be primarily health related. And if they are primarily health related, which is sort of a complicated test, a Medicare Advantage plan can offer those and include those costs on the benefit side of its medical loss ratio. And so we've seen a whole host of really interesting things being offered that aren't traditional Medicare benefits by Medicare Advantage plans. So that could include, for example, access to health and wellness coaching services. It could include access to health apps. It could include apps to dieting, other services that we traditionally have not defined as Medicare covered services, but that are still primarily health related and fall within this new category of supplemental benefits. So that's a huge growth area. If you paid at all attention to Medicare open enrollment this year, plans were largely differentiating and advertising themselves based on those supplemental benefits. Another example would be, for example, eyeglasses, right? That's not a traditional Medicare benefit, but is offered under that same flexibility. So I think that's going to be really a large growth area to watch for, particularly, and a real opportunity for health and wellness coaches and health educators to integrate themselves is through the use of, is as a primarily health-related supplemental benefit for Medicare Advantage plans.
Now, I guess maybe this will also tap into your legal experience. For anyone who is interested in like a startup or something that, wants to get into health coaching and kind of, figure out what the services they're going to offer, do you have any, I guess, either legal advice, not really advice, but suggestions, or perhaps like how to go about maybe contracting or positioning themselves so they are better able to get some of the reimbursement when it does happen, or even if it's not from Medicare or Medicaid, from a commercial payer?
Well, most of the work I've been doing lately is really around integration of coaches into existing healthcare practices where the billing is occurring on the physician end itself. I do understand there are models, and I've been a part of some of those models, but they're all in the commercial market where, you could have, for example, a health coach app that where that company has negotiated rates with a commercial payer. There's less rules, regulations, and frankly, fraud and abuse risk when you're talking about negotiations with commercial payers. Mm-hmm. You have to be very careful, and I would frankly urge folks to consult attorneys when they talk about billing the Medicare program or billing the Medicaid program, because there are very specific rules about who can bill and when and for what types of services. So unfortunately, it's a really complicated environment, which has, I think, discouraged, probably some of the growth we would have otherwise liked to see. One thing that I, continue to urge is for the federal government itself to put out more guidance, which we haven't seen. There's been some guidance, for example, on the use of health educators and the annual wellness visit. But there hasn't been really any direct advice from the Medicare program on the integration of health and wellness coaches or health educators into practices. That's something that we continue to look for and encourage CMS to put out to make compliance easier, right? Because in some cases, we're operating a bit in the blind here and doing our best, doing our due diligence and really just trying to, with good faith and with reasonable belief, rely on the guidelines as they exist, the regulations and the statute, and advise our clients the best we can.
I'm glad you mentioned that, because one of the things that we stress in some of the continuing education courses we have is the health coach knowing their scope of practice, knowing what they can and cannot do, knowing exactly, you just don't come out outside of practice and say, I'm going to build this insurance and build that insurance. They do have to get that legal expertise if they want to branch into the more complex billing and receiving of payments type of stuff.
And there has been some, confusing examples where, for example, I talked to a group that had health coaches, but those health coaches all had various different licensures, right? So some of them were licensed counselors, some of them were registered nurses, and it's a little more complicated there, because the question then is, well, for purposes of integrating and interacting with the Medicare program, are you interacting as the health coach, or are you interacting as the clinical social worker who has clear billing authority for these certain codes? And the health coach, in most cases, we've needed to sort of fill in the holes where it might say, this code can be billed under the supervision of a physician for auxiliary personnel. And auxiliary personnel is defined in the CPT manual. And we read that definition. We say, well, I think a health coach, is someone that by training is capable of providing these services. But there's underlying assumptions there that make it difficult.
Now, what do you think about the CPT codes that came out last year for the health coaches? Like, what do you think the future looks like? I think they're going to get approved eventually, but
right now they're Series 3 codes, which aren't payable by Medicare, but it certainly is a move in the right direction. I think it was, I think the fact that there was strong support from a wide variety of healthcare practitioners, really, and the fact that the codes reference particular standards, I think is also important, right? So that there are still standards built around, who can use those codes and what is required to be, to call yourself a health educator or health and wellness coach. I think it's going to be a long road for those codes to be directly payable or reimbursable under the Medicare program. But do I think we'll get there eventually? I do.
I think so too. Now, the other update I heard was the taxonomy codes for the health and wellness coaches, which kind of allows them to get an MPI number now, which probably, so I don't know if you can speak to it or not, and it's probably out of your scope, and that's fine. But I know health educators already have that taxonomy code, and now there's this one for the health coaches. Like, would a health educator still be able to list themselves under that taxonomy code?
Good question. I unfortunately can't speak to it, but it's a great question, and I agree. The novel issue of an NPI for health coaches raises a whole host of new issues, but also possibilities.
Yeah. What about the self-insured industry? Is that something that you can speak on? I know I'm not really, even for myself, it's the concept I struggle a little bit to understand how they're different from like your traditional commercial payers. But often when you read, articles, it's often cited as an area that could use help with reducing, costs, especially if they're offering services to their employees. And, because they're self-insured, they want to make sure they're spending the money properly and they're not spending a whole lot.
That's exactly right. So self-insured employers, unlike a fully insured employer, have control over their benefit, and thus, particularly I'd say this is more common for larger self-insured employers, have a real interest in taking a look at their costs over time and seeing where they can accrue savings. And so I think there's a unique opportunity for health coaches, health educators to market their services to self-insured employers, because one, there are not the, again, the sort of restrictions that would occur in the Medicare and Medicaid programs for integration of those providers. And two, to the extent there are studies, I think most of these employers are going to be interested in seeing either peer-reviewed or longitudinal or some other total cost of care study that shows that your services are going to lower their overall cost. There's, healthcare is expensive across the spectrum, but I think these employers that are self-insured see it more on a day-to-day basis because they're able to see the actual claims. So they know how many employees they have that have diabetes. know what the cost of that individual over a year is. And so it is easier probably to make the case to a self-insured employer that there is an economic case to be made for the integration of your services to the extent you can demonstrate the cost savings.
Okay. Now, I'll be mindful of your time, and I appreciate having you. But before I let you go, do you have any final words for the audience, for anyone who's interested in getting started, positioning themselves better, or perhaps already are a health coach and just kind of want to elevate themselves a little bit more, given, things have rapidly changed even in the span of 1 year?
Yeah, well, I mean, I would certainly first give a shout out to the National Board of Health and Wellness Coaches, also the Health Educator NCEC or NBME, who have done a great job educating their members on the ability to use certain codes and to bill. And so I would want to encourage folks to reach out to them because they're doing a good job trying to help the industry grow. I would pay a lot of attention. What I would frankly do is pay a lot of attention to what happens over the next couple of years, because I think we're going to see some really new flexibilities. I think it'll be interesting. I think health educators and health wellness coaches are uniquely situated to take advantage of telehealth and remote patient monitoring. And we are going to see undoubtedly a huge growth in that area. I know right now we're operating under a number of temporary waivers that allow, for example, audio-only telehealth that we wouldn't normally receive. But I think Congress is going to be pressured to make some of those changes permanent. And so the opportunities for mobile apps, for video chat, for remote patient monitoring are really endless and will only grow. So I would encourage folks to stay on top of the regulatory developments in this field, because I think we're only going in one direction, and that's growth.
Thank you so much, Russ, for your time. I appreciate you, and thanks for being a part of our summit.
Thanks, Chinelo. I appreciate it. It was fun.
Thank you. Hello again, and that was a great interview with Ross. We had a great session talking about a whole lot of changes and trends in the health coaching industry and what's coming up. So this session that I'm going to talk about briefly, I guess we kind of mentioned it a little bit in my interview with Ross, I guess, based on the timing when the interviews happened and how we ended up facing the agenda, but yes. And so this session is on industry updates and specifically tailored more for those who are nationally board certified health and wellness coaches. So in fall of 2020, the National Board of Health and Wellness Coaches applied for a taxonomy code for health and wellness coaches. And recently that's been granted approval and will become effective as of April 1, 2021. So that is a significant step for the industry, and it signifies growth, it signifies a positive direction for healthcare and for health coaches. And so again, the National Board of Health and Wellness Coaches, they're really helping to move the industry a little bit further in collaboration with NCHEC as well. And so what exactly is a taxonomy code? Well, a taxonomy code is a unique 10-character code that designates your classification and specialization. And so there is now a taxonomy code for health and wellness coaches, and the code is a 714 followed by a string of zeros and an X number. And this code will become effective, like I said, April 1 of 2021. And it's commonly referred, the code is used for application for an MPI number. And I'll talk about that in a few minutes. But who really oversees this taxonomy codes? Well, the codes are overseen by the National Uniform Claim Committee, and that's kind of chaired by the AMA and the Centers for Medicare and Medicaid, and it represents, payers, healthcare organizations, public health organizations, and vendors, and maintenance organizations, and the like, when it comes to reimbursements and standardization of transactions. And so the whole point of a taxonomy code is to be able to use it when someone is applying for an MPI number. And an MPI number, for those who are not familiar with what it is an identification number for covered healthcare providers. And it was created and is created to help improve efficiency and effectiveness of electronic transmission of health information. So you can imagine the millions of patients or people that visit a doctor's office or a provider's clinic, and the amount of transaction that goes back and forth. Well, all of that is streamlined by having an MPI number. And as healthcare professionals, I myself, I do have one. That MPI number kind of follows you wherever you go. It never expires. The application process is pretty simple, and it's free, no cost. Most people I've heard can get it in within 5 days by email. But as a professional, when I applied for mine, it was pretty instant. And then we'll kind of talk about this a little bit in the next session with Teri Elkins, and we'll get more in detail as to where we can use some of those MPIs, or we're currently using them as health coaches. So who really needs an MPI number? Any healthcare provider, any healthcare clearinghouse, healthcare organization that conducts transactions or uses health records that fall under HIPAA will require an MPI. Again, for me, this signifies a growth for the industry in the right direction. And as one is building himself or herself up as a health coach, or if you're a health educator trying to build yourself up into a health coach, these are some of the things that you can start getting yourself familiar with. If you're already not familiar with what HIPAA is, what an MPI number is, and some of the basic terminology that's needed. But the MPI number, the companies use it for medical billing to process claims. Again, to me, what this signifies is we're making huge steps and huge strides towards getting those reimbursement coverage for health and wellness coaching in the future. And so the National Board Certified Health and Wellness Coaches will need an MPI number if they work for a healthcare organization or are in partnership with a physician, and if they currently have the ability to bill for insurance. And so that is the update that I have for you. I think it's great news. I think we can all keep up with the work to advance the profession. All right, so for this session, we have another special guest with us, Ms. Teri Elkins. She is a diabetes prevention program specialist and lifestyle coach, and we'll be talking about everything diabetes prevention today. So without much ado, I'll turn it over to Teri and we'll get started.
All right, hello everybody.
Hi, Teri. Can you tell us a little bit more about your background and how you got started in diabetes prevention?
Yeah, so It all kind of started probably about close to 16 years ago. So at the age of 3, my son was diagnosed with type 1 diabetes. So that kind of threw my life into a little bit of a spin. And right prior to that, that happening, I actually went through a big weight loss journey of myself. So I was able to lose over 75 pounds.
Wow.
And which kind of spurred me to kind of go back into school. I actually worked in the finance industry for over 20 years. But I went back to school to kind of get my health and wellness, and it kind of just went from there. So very passionate about the health and wellness, and especially diabetes prevention. Unlike my son who has type 1, which is an autoimmune disorder, there's, he can manage it, but, there's no lifestyle changes he can make to actually prevent or reverse it. Yeah. So that's kind of where my passion and my background kind of came from.
Okay. Myself also a diabetes prevention. I'm trained to do diabetes prevention.
Yeah.
So I'm a lifestyle coach myself. And of course, I have family members that are dealing with it. And we see people that come through the pharmacy who have pre-diabetes, have type 2. And like some of them wish if they're type 2, if they knew if they had the information we have now, if they had it 20, 30 years ago, maybe their, disease pathway or progression may have been a little bit different. And so I know you do work as a DPP program coordinator. Can you tell us about your program, how you got started setting it up, if you had to do that, or how your organization launched into it?
Yeah, so with the organization I'm with, Sun Health Services, we're located in the West Valley of Arizona. I joined them in 2019, but my relationship with DPP actually started in about 2014. I was at a diabetes health fair, and I happened to talk to the director from the YMCA, and we started chatting, and she's like, "You would make a great coach." And I'm like, "Oh, that sounds great." At that time, I was getting my undergrad in health and wellness, and I'm like, well, I kind of want to get into it. So she actually recruited me to be her coach. So that's where I got my training. DPP through the YMCA from about 2014 to about 2015, 16, when I left the Y to actually start running my own business in health and wellness. I left corporate world to do that. And then probably in about 2018, I was hired on as employee wellness specialist for a large hospital in Arizona and tried to implement DPP, but Sun Health actually had an opportunity for me to replace their coordinator. She was leaving, and it was a great opportunity. I wanted to get more involved in DPP. So I joined here. So Sun Health actually launched DPP in about 2014. And they became recognized. They got full recognition in 2017. Then in 2018, when Medicare approved it, started covering it, they started offering it and then became a Medicare supplier. So when I came on board, we are the only Medicare supplier in the entire state of Arizona that can offer MDPP. And being in the West Valley, we have large retirement communities here. So we have a large population. Since joining Sun Health, I've been able to grow the program to adding additional locations throughout the West Valley. And within my first year, I worked on a project with our strategic director and chief officer to actually launch online DPP. So right now we are using a brand new curriculum. We partnered with a local partner in Arizona to actually launch online DPP. So now our participants can take DPP in person with us or online with our platform, where they get interaction with me on a daily basis, or a combination of both, which has been really helpful during COVID, where I have participants who I want to start in person, and then they're like, ooh, I don't feel comfortable coming in. Can I go to the online platform? And they can. They have that option to go back and forth right now. So we're looking at some additional partnerships to kind of expand our DPP and help other Arizona organizations become Medicare suppliers. and help with sustainability because we are able to bill. So we do have that sustainability, which a lot of organizations in Arizona kind of have that barrier right now. They don't have sustainability for their program.
Yes, because we do offer a continuing education course through Pharm PH on diabetes, pre-diabetes, as well as the diabetes prevention program. And a lot of things that, questions that come out, or when I talk to people about the DPP program, is how sustainable is it?
Yeah.
Like, what's the positive financial package to the company that's, organizing a DPP program? How are they able to sustain? How they're able to make money, pay the employees, and keep all these things going? Can you speak a little bit on that?
Yeah, so I would say, because it's not a huge money maker, that is for sure. And with Medicare, the Medicare billing system is very complex. It's not an easy task. But the biggest thing, what I'm really proud of, what we've been able to do, especially since I started, is making sure our participants hit that 5% weight loss. So when I came on board, our average weight loss per our DPRP report was 2.4. Our last report that we got, we're at 6.7.
Wow,
weight loss.
That's awesome.
Yeah, so that's exciting. So it's been a lot of hard work because I am the only coach too. So I'm running the program and I'm teaching it by myself.
Oh, wow.
So,
you're a big woman.
But what I find is just, being able to get that 5% is really where the money is. And also I'm part of our Arizona State Diabetes Coalition. So okay. I'm heavily involved with that and working to get that sustainability because it is hard, even with Medicare and, in trying to lobby and try to work through our legislators, because we run into issues with Medicare Advantage plans.
Mm-hmm.
Especially being the only Medicare provider in the state of Arizona, we get some Medicare Advantage plans that will tell us, sorry, we have a closed panel. Sorry, your participant can't take this program anywhere else in the state. So we need to work something out. So I'm working on those types of contracts right now with those Medicare suppliers. And as a state, we are working with to get Medicaid to cover it. So another part of my role with working with the state is we have our Arizona Diabetes Action Plan that we just launched the second one. And we're asking them let's get Medicaid to cover this because, then we can get more, more enrollment. And then also teaching other organizations. We just had a quarterly meeting and I had one of our credentials actually give a presentation on how to get credentialed. Because there's a lot of different aspects you have to get as, your MPI and becoming a Medicare supplier and then trying to work with our commercial payers, that aspect for sustainability. Recently now with our online platform, we're reaching out to employers because now we can reach employers anywhere and on any device. So that's another huge important is that sustainability. And then recently we hired a community outreach person. So he's really trying to target working with more physicians because we do have some physicians that refer to us, working with pharmacists. We have 2 huge, healthcare facilities by us. And also everywhere I go, I end up talking about it. So my dentist, I get referrals from them. My chiropractor, I get referrals. I see a specialist, in Chandler, she sends me referrals. So it kind of just comes naturally, the referrals, because I'm always talking about it. I'm very passionate about it because it is a great program, but trying to get, that sustainability and the insurance barrier, trying to work through that to help other organizations because, there's a lot of red tape to try and get through to get that sustainability. And a lot of organizations give up.
Yeah, I can certainly agree. And I'm glad you mentioned some of the things I was actually going to ask you about, which is the insurance piece and like the Medicare and the Medicaid and the contracts. Like I know, for example, Medicare Advantage plans, they look like they're a good place to start because they're sort of Medicare, but they're also private. And the perception would be it will be easier to work with companies like that. And I'm hearing from you that
yeah, once you become a Medicare supplier, and if somebody has straight Medicare, you're on the enrollment, we never get issues. Those are the easiest. But once you get Medicare Advantage plans, trying to get contracted with some of them, because it is a private. So for instance, we have 2 large ones in Arizona that have a closed panel. So we're trying to work with them to say, okay, I understand you have a closed panel. However, we are the only ones that can provide this program to your Medicare beneficiaries. So, can we work out some type of agreement where you will contract with us for this program specifically? Otherwise, their members can't take it, and it's a preventive service. It's covered under Part B, so we know they have it. So it's more difficult to work with the Medicare Advantage plans.
Now, I know it's difficult. How, I guess, once you break it down for them and say, can we work on this particular disease state? I'm not telling you to give me access to everything that you offer, but I'm just saying, hey, let me work out a contract with you for diabetes. How receptive have they been? And what does that contract look like?
Yeah, then once you truly understand what the program is, then they're a little bit more open to be like, oh, okay, I understand, let's get the ball rolling. Because I explained to them again, then your members can't take this anywhere. And we're the only organization in the entire state of Arizona. So the biggest part is trying to explain. What I find is the minute we call in, if we, start the conversation with diabetes prevention, all they hear is diabetes. And they're thinking like DSME, which we offer too. And I'm like, no, I'm like Medicare diabetes prevention. And then after I say prevention enough times, they're like, oh, it's a preventive. Yes, it's preventive, because a lot of people still are not familiar with it at all.
Yeah.
What it is. So, it's still a process, but they're a little bit more open and willing to go through the whole process of, okay, yeah, let's go ahead and work out a contract with you, because per, Medicare, if a Medicare Advantage, if there is no in-network or out-of-network provider, they have to cover it, and they can't do cost sharing too. So it's a lot of education. So again, through the Arizona State Coalition for Diabetes, we're trying to get some lobbyists, some things changed where this process isn't quite so difficult, because it can come quite time consuming, and to the point a lot of organizations like, I don't even want to deal with it.
Yeah, I agree.
I don't want to deal with this kind of stuff, and the follow-up and all that kind of stuff.
And the reason we're talking about diabetes prevention is because the majority of the audience listening are looking into health coaching and ways that they can branch into health coaching. And of course, diabetes prevention is very natural to what a health coach should be doing anyways. Yeah. So it's good even for the health coach to be aware and knowledgeable about DPP program and see how they can incorporate it as well. I'm glad you also mentioned that you guys went virtual, because of course with pandemic, you're able to reach a wider number of participants.
Yeah.
And, can you speak? I know some people have struggled with retention when the classes were being offered in person. Now that it's virtual, have you seen that it's increased your retention rates in the program, or it's about the same?
I think it's helped increase tension. Again, because the company that we partnered with, they're from Arizona to launch this online DPP. The curriculum is from 2016, that's CDC approved, so it's different curriculum, but I interact with them on a daily basis. And there's no live classes, so they don't have to download Zoom. They don't have to download any type of that. There's video modules that, they can log in and watch throughout the week. They're able to upload their food journals. I send daily messages with additional handouts to help keep that interaction. They can send me messages and we can correspond one-on-one. So they actually really get more one-on-one coaching. And for anybody who takes the DPP in person, they get the option to get access to the platform. So now, in between classes, they're able to do their food journaling, which I'm finding is helpful because they won't fill out a piece of paper and give it to me. I wasn't getting that. Now they're starting to food journal. If we get a lot of, because of the Medicare population, where they go back home during the summer and they'll miss 3-4 sessions. Well, now they're like, oh, I'll just take it online then. I'll just do the online and I can track engagement, see that they did it, they uploaded their weight. So it's really helping with retention on that aspect too. And they're loving the curriculum, and the video modules are 10 minutes or less.
Okay.
So yeah, so it's great. And then again, there's, you know, messages every day, and there's a community feature so they can still interact with their group, everybody within there. So, and I find with the platform, they're more open because they have that one-on-one and they're more comfortable. So they'll share, you know, more of their struggles. So it's been great. It's really been great to help kind of launch it. And especially with Medicare, because of the public health emergency, they're covering virtual, the same as it was in person. So, yep. So that's the great part. And we did get a little bit of funding to help with this project. So they get a Fitbit scale that links to the platform. So they just have to step on it. So now we can reach our Medicare population, you know, really anywhere within the United, I mean, anywhere.
And speaking about the reimbursement, are you able to speak a little bit about the dollar figures, what the reimbursement looks like, so people know, like, have an idea?
Yeah, so for Medicare, if they reach all their attendance milestones and they, you know, achieve and maintain that 5% weight loss, within the first year, you can expect to get about $500 in reimbursement.
Per person.
Now, well, yeah, for the first year. Now, what most people don't realize is for the Medicare DPP, there's year 2. So if they've reached their 5% in attendance, they can go to year 2, which can be an additional $200 in reimbursement. So altogether, you could get about $700 for reimbursement for the whole program. So it's still not a huge moneymaker, but it is something too.
Yeah, and it definitely adds up if you have a, you know, a larger population, and it's certainly a service that people can offer in addition to everything else that they're already doing.
Yes, yeah. And again, if you can get just straight commercial, you know, contracts with them, you can negotiate, you know, a $400 per participant, period. Or if you get employers. You know, actually, we were able to sign up our own organization as our first employer. So that was kind of nice. I get feedback and so that's been really great too, especially with our executives, to be like, hey, this is what, you know, this is what you guys approved last year. This is what it looks like. And they're loving the feedback, and which is really good. So again, those, you know, different avenues of reimbursement is really key to get DPP to be sustainable. Besides medical reimbursement, other avenues, partnering with other organizations to get grants. That is always another way to help, you know, have the program be more sustainability.
Now, I know you mentioned, of course, the DPP is reimbursed through Medicare, and then people on the state level work to see if Medicaid can cover similar program. But with commercial, have you lowered your age requirement? Because I know, of course, being Medicare population at 65 and over, if you're commercial, and you can correct me, I assume you can tailor your program a little bit more to different age groups, with, you know, or to employers.
Yes, so we just followed the CDC guidelines for the program, which indicates you have to be over 18 to participate. Your BMI. What I love about the non-Medicare eligibility for DPP is you don't necessarily always have to have that blood test. You can do a risk assessment, and they can qualify off of that risk assessment too. So that's kind of a nice part, that you have a little bit more flexibility with that compared to the Medicare is you need a blood test. There's no ands, whats, or buts about it.
Now, I'm curious because I know remote patient monitoring is also picking up, and I know I'm hearing you saying that you guys got a grant and you're able to do the Fitbit monitors and scales to your patients. How does that fit into this whole aspect of remote patient monitoring?
That is something I just discovered earlier this year. So I brought it to our leadership and they're like, really? Are you sure? Can you check into that? Let's make sure before we start. So of course, you know, we will need grant funds first, but yeah, that's something that I just brought to their attention that I'm like, hey, did you guys know that I think we can, if we, use this budget for the Medicare, this might be something ongoing that we can get funding for. So that's another thing with being, sustainability is staying up to date on all these changes, because they happen a lot, especially this last year. It's happened a lot.
I agree. Now, you also mentioned credentialing, and it's also a good reminder for our audience, for you to bill Medicare for a DPP program, you have to have an MPI. Can you speak about your credentialing and how you got started doing that?
Yeah, so when I came on board, of course, the organization I work for, Sun Health, they already had their MPI, because we were running the program and other programs. So when I came on, I applied for my own MPI, which I do have another certification. I have my Certified Health Education, my CHES certification, and I was able to get my MPI within 24 hours with that license. I had a coworker who has a master's in physiology, and it took him a week. So I really think that credential really helped me. So, you have to get that MPI. And another really important aspect is for the Medicare is make sure you're on the Medicare enrollment for MDPP. That is very crucial to get that updated. Otherwise, if you do bill, your claims are going to get denied.
Now, when you say Medicare enrollment, can you talk a little bit in depth about it and the platform and
yeah. So, if your organization takes regular Medicare, that's great. But for the Medicare DPP, you have a separate enrollment. It's a whole different enrollment. So we actually have two. So within 30 days of hiring a new coach, you have to add them to the roster. So then when you are submitting these claims, especially through Medicare, it is recognized that, oh, yes, this person is a coach. Because when you do your billing, you have your main organization is the billing provider, and then your coach is your rendering provider. So if they're not on the Medicare DPP enrollment, you're not going to get reimbursed. That is, and it takes Medicare a while, so you have to be on top of it. Yes, yeah, I recommend you wait until you get the verification that they did approve you before you submitted any claims.
Now, how long did it take you for the Medicare enrollment?
It took they were behind. It took them 90 days.
Oh wow! Okay,
but they do backdate it from the time of your application.
I see. Okay.
Yeah. So I just said, you know what? Let's not submit anything until we get that verification. And then let's move forward. Otherwise, we're going to be looking at a bunch of claims that are denied, and we'll have to redo it again. So let's not do that.
I'm also glad you mentioned, because you have a CHES certification. So with your CHES, did you have an NPI with your CHES?
No.
Prior to,
no. But it helped. I think it helped me get my MPI much quicker. And there's another project that I'm working on with anybody who has a CHES or an MCHES or a certification through another organization where health coaching would be covered as a billable service too, just for national, commercial plans too.
Okay. What program is that?
That is through the National Boards of Health and Wellness.
Wellness coaches. Okay. Yes. Yeah.
Yep. So I'm working with them too to collect data where, let's say, somebody just wants to come in for health and wellness coaching and they don't want to do DPP or MDPP. We could bill under this code and still provide that coaching that they need, because not everybody feels comfortable in a group setting.
Yes. Yeah.
Or they don't want to commit to a year. They think that's a long time.
And I think with everything going on with the credentialing, it's going to add a lot more value to what the health coach does and what the health coaching profession has to offer. Because I think about 2 weeks ago, the National Board of Health and Wellness Coaching got the approval for their own MPI as well. And so, I think that's going to be great.
Yes. Yeah, it is. It is.
Now, what suggestions do you have? Oh, before I get to that question, you said you also do DSME as well with your program. Okay, and how are the two programs for you? because do you still market to the same population, I'm guessing, the 65 plus and commercial and employers. But can you speak a little bit about DSME? Because I know MCHES are eligible to become CDEs as long as they have their practice and everything. So, and it's funny because sometimes people wonder, how do they get experience? Oh, I'm MCHES, I'm a CHES. How do I get experience to sit for the CDE exam? Because you have to have, 1,000 practice hours before you can sit. But, if you start offering the DPP program and start seeing patients,
boom,
guess what? There you go. But can you speak about your DSME program as well for our audience?
Yep. So we have our diabetes self-management education program that's taught by our RD, who's a CDE. And of course, as you guys know, that's for patients who have diabetes already. It's a 5 to 6 week course that teaches healthy lifestyle. That program is 100% in person. They can do a little bit of virtual, but they found to be more successful in person. So we offer that right at my location too here. And so we've actually been able to launch new cohorts, since July. So we have very limited, 9 people or less. We have them socially distanced, wearing our masks, everything, but we're able to help with that too. And we have a couple physicians that we work with that we get lots of referrals from to participate in this class too. So, it's great because we can, of course, help you on the prevention, and we kind of want to help you prevent it. But if you do have diabetes, we're here and we can help you too on that end. So that's kind of a nice aspect, is we can help you on both sides of the coin.
How is your enrollment for the DPP? Like, how often are you taking participants? Do you, start in January and you work with the same patients to March and you're not taking anybody in between, and then you start up again? Or how does that recruitment work, I should say?
I am usually starting about 6 to 8 new cohorts per year.
Okay.
So it really depends on what current classes I have, the availability of our community room, and if I want to take time off. I'm like, no classes on Fridays, I want time off. So that kind of limits how many, but I usually start every 6 to 8 weeks. I always start one at the end of January. Okay. So I started January 28th. We started a cohort. We're starting a new one on Monday. Okay. And then I have a couple cohorts where it's going to be 100% online. So just online. And then this summer I'll be launching more. So it's kind of, it's very tricky, and I have to be very strategic of how I plan it compared to what I have going, when a class is ending, when the room is available, and if I want to try and take some time off.
I agree. And then I know you also have to do a report to Medicare every so often for the program. How is the reporting process like?
Yeah, so for me, I have the report that goes to Medicare each quarter, and that report isn't bad because it's ongoing. So you're just adding the new participants. So that part's not too bad. And then because we do have, in person, and we do have an OR code now for online, I have to do the DPRP reports every 6 months, and those are on different calendars. So there's that reporting too. And then I have additional reporting just because of this special Medicare enrollment project that I'm involved in. So you always get reminders, so that's kind of good. But I have a book just dedicated to when all my reports are due, how I need to title them, what they need to be in. I do use what's nice with the online platform I have for DPP, that generates my online report for my DPP report. And then another system I use through the AAED called DAPS.
Yes. Okay.
Yep, I love it. That's what I use for my in-person. So that helps to generate that report. So having systems like that is crucial for data entry and data reporting. Otherwise, it would make life very complicated.
Yes, I do. I couldn't agree more, because, when people are picking like a practice management software or tool, it's good to know that the easier you make your life, the easier you make everything else that you have to do. Yes. So paying attention to those, platforms or systems that you're purchasing for these programs, then you may have to pay a little bit more, But if it saves you that extra time, if it gets your reports all done, your figures in one spot, why not? And then, of course, the AADE has a lot of resources for people who either want to do a DSME program or want to do a DPP program as well, for those who want to launch into it.
Yeah.
Now, have you found yourself having to know a little bit about medical billing, or like the codes and things, and and how crucial is that for people to?
Oh, yes, I have dived into the medical billing quite a bit here. So we don't have a separate medical department just for the billing aspect. So me and the other office coordinator, we have educated ourselves quite a bit on how that works. And worked through some struggles with that too. So again, that's a very complicated process. Lots of training out there, like Medicare has billing and claims, webinar. But again, if your ducks aren't all in a row, your claims are going to get denied. So if your MPI isn't set up correctly, if you're not the Medicare enrollment, if your facility is not, a provider within the network, all of that kind of stuff, and keeping on top of those claims, to see, okay, they're rejected. And sometimes it's calling them and educating them again and being like, no, this is something different. But making sure you just have all the proper codes in there too. I developed an Excel spreadsheet that when I'm updating their weight, I have the spreadsheet that checks to let them know what they should be billing. Because with the Medicare billing, it is, the first, let's say 9 weeks of the program, you get to bill the first session, and then you bill after 4 sessions, not session 4, but after 4. So if you have somebody who missed session 3, well, now you're not going to bill for that 4th session. You're going to bill for week 5, but it's going to be week 4. So I had to develop an Excel spreadsheet just to keep it straight. Otherwise, I'm lost. And then I can send it to her, and she can just follow it.
Now, I heard you saying that you've been reaching out and doing education to other organizations in the area in Arizona. Do you guys do that on a consulting basis? Do you offer consulting services for non-Arizona people who may be interested in starting DPP? I know it's one thing to do the Medicare webinars and everything. It's another to speak to somebody like yourself who's actually doing it, and then I can ask you my questions the way I have it in mind. Do you offer that type of service?
Yeah. Okay. I've met through quite a few DPP organizations in Arizona. I have a couple where we're looking under the umbrella agreement.
Okay.
CDC to help them get their recognition. And so if there's going to be some services where I have to do some extra data entry, or we need to do billing and claims, then of course there's going to be like, okay, so this is what the extra cost is going to be.
Okay.
Do they have an 1815 grant from the state to help pay for that? Any additional costs. But a lot of times if they just have questions, I just give me a call and let's just talk about it.
Yeah, the reason why I was asking is just in case anyone in the audience.
Reach out
too, and
that's what we're here for, to help each other. It is a very complicated process, and I know, like, for Arizona, being part of the Arizona Diabetes Coalition and chairperson for DPP DSME is to help our organizations become Medicare suppliers, help with sustainability, help educate our healthcare professionals that, hey, we're out here, let's help, and just working. Some of the referrals I get is I got a referral from a wonderful person who helps write our grants, just because she learned about DPP, and she's like, hey, I have this other nonprofit that's looking to implement more preventive services. I think you would be a great fit. Now that I know what DPP is, can I send her to her? And I'm like, absolutely. So we're looking at a new partnership to bring DPP to people who have transitioned from homeless to housing now. So we're working with another nonprofit to hopefully bring DPP to their residents.
Well, you certainly keep busy, Miss Teri.
Yes,
I'm a busy woman. Now, I appreciate you being on this talk with us, but before I let you go, any words of advice or anything else you want to share with the audience who want to launch as a health coach are interested in doing DPP or DSME. Anything else you'd like to share?
Yeah, just feel free to reach out to me. We can brainstorm, chat. There's lots of ups and downs when running this program. So no, we're all here to help each other. So please feel free to reach out to me. Let's have a conversation and, help each other. And if you truly believe in the program, you will make it happen. You'll just automatically put that out there and resources will come too. So yeah, that's it.
All right. Well, thanks again, Miss Teri, for all your time. And I'll post your information on the website for people who want to reach out to you. Well, at least your email address.
Yes, perfect. All right. Thank you so much.
Thank you.
All right. Bye.
Well, hello again, and this brings us to the end of the summit. That was a great interview with Teri Elkins at Sunrise, almost like she kind of summed up everything we were talking about in the summit. And it's funny how everything kind of worked out because it wasn't planned that way, but it looked like it was a good summary of the different sessions and the different strategies that we've kind of touched upon throughout the summit. For those, if it's not already up on the website, her email address is teri.elkins@sunhealth.org. And she's definitely open for anyone to reach out to her with questions and for collaboration, even if you want to do that. So just to kind of summarize everything we've been talking about these past couple of days, it's been a whole lot of information. I personally enjoyed the interviews. I learned a lot doing the interviews, and even for myself, it's kind of given me some tools as well as I broaden my skills as a health coach and also a health educator, but we are all on this journey together. We started off the summit with Miss Margaret Moore kicking us off with the history and background as to how things kind of got started and just the movement in general. And of course, she is the co-author of the Coaching Psychology Manual, which is the Bible for health coaching. I know some of the instructors in our life classes have mentioned that coaching manual. So it's definitely a great reference and tool to have. Then on day two, we heard from Zakia Moore. Day one, we also heard from Zakia Moore, who is a nationally board certified health coach. And she shared her expertise and some tips as to how to get started as a health coach. Basically, tap into your network. If you have friends, family members, co-workers, kind of get started somewhere. And just going off of what Margaret Moore, aka Coach Meg, said in her opening speech, it takes time, it takes practice as a health coach. And if you already have a network that know that you're going to be doing health coaching anyways, you might as well practice your skills with them. And then followed by Suzanne Lindberry, who is a certified health education specialist, but's been working in the role of a health coach for a lot of years. We talked about the annual wellness visits that health educators can provide under the supervision of a physician. And the article that they have published in the American Journal of Family Medicine is a great resource for anyone who wants to incorporate health coaching into their practice. So I would highly recommend finding that article. It's posted on the website. It's posted on the internet, adding health education specialists to your practice. It has great information, great resource as to how to go about bringing a health coach into your workflow, or if you have a health educator, some of the things or functions that a health educator and health coach can do. And she also mentioned the call that NCHEC has. If anyone is currently working in the role of a health coach or utilizing the CPT codes that we've been talking about, please do reach out to the organization so we can form that partnership and keep that data tracking going. Because we want, obviously that's the goal, for the CPT codes to go from a category 3 to a category 1 where it gets reimbursed. And that happens with data collection. And so if anyone is involved with a physician practice, or my goal is for people in the audience to kind of be stimulated by what you've heard and we've talked about, and the information kind of be, if you're already enthusiastic about it, be stimulated to utilize the information to grow yourself, or help your organization, or form partnerships so we can continue to advance the field and profession of health coaching. Now, on day 2, we had sessions with one of our sponsors, Healthy, and we talked about the platforms for health coaching. And typically, the day 2 was when I looked at placing the content together. It was more about resources for health coaches to be able to utilize in their practice. And so Healthy is a platform for wellness professionals, also independent wellness professionals, but it also allows for group practice as well. And I know in one of the level packages that we have, for access packages that we have for the summit, there is discounts included for people who bought into that access. It is a great platform for using. They do have webinars, and on a, I think, weekly or monthly basis to kind of keep you updated. It's a great platform. And then the follow-up session to that was the one on nutrition by Ashley Fabian, who also happened to be using Healthy as a nutritionist in her private practice. So it wasn't a planned I guess, occurrence. I just happened to find out during the interview that she also utilizes it. But her session mainly was on nutrition and nutrition education for the health coach. And one of the reasons I wanted to incorporate her into the summit is because, nutrition is such a key part of a healthy lifestyle that as a health coach, you will be almost guaranteed to get questions from your clients about what to do with nutrition or eating healthy or meal planning or what the case may be. And so to kind of have her give us tips from her background as a nutritionist and also as a health coach. And so for yourselves too where your boundaries are, what you can and cannot do, and advice that you cannot give and you can and cannot give. Because health coaches and nutritionists, we are going to be talking about the same thing, but the approach to how we answer the questions or help our clients are going to be different based on your scope of practice. And so that was great having her on board to kind of share some of those tips. And then we had Naisha Deeds from Pure Spark talk about mental health. And again, mental health is one of those fields that is exploding, especially now that we are dealing with COVID-19 and a lot of people are working from home. You find that your home is your workplace, is also your home. It's your school for your kids. It's where you sleep. You go to work. Pretty much everything now happens in the house. And for some people, it's kind of taking a toll on them. And if you're still working, you're an employee from your house. And so mental health is an issue that's not going to go away. And it's going to be addressed sooner or later by, a lot of employers, especially possibly in the corporate and wellness section. And we kind of touched upon some of those strategies of working in corporate health and wellness when we talked to Zakia from day 1. So kind of everything connecting together. But Naisha's Pure Spark also offers a peer support group, which is virtual and can be accessed anywhere throughout the country. And again, one of the reasons I interviewed her is to be able to provide you guys with information and resources. So when you're out there and helping clients and you kind of think about, oh, how best do I help my patient or the client that I'm working with in terms of mental health, and at least you kind of have some sort of resource to go by and tap into. And then, of course, we have our speakers today who were great and had lots of information. Sometimes, even for myself, it kind of feels like overwhelming because there's so much information contained within, these different interviews and throughout the entire day. But I think it's great information, and it just kind of speaks to where we're going in the future, especially with, telehealth and digital medicine, and that's giving way for lots of innovation and partnership for auxiliary personnel, which, like Ross did mention, there is that statement that, auxiliary personnel can assist in certain functions with a physician practice. And well, you can say a health coach or health educator kind of fits into the auxiliary scope. So it's pretty much you building yourself up into the role that you're going to be stepping into. And of course, we kind of close it off with Teri Elkins in talking about diabetes prevention. Again, if I strongly encourage anyone out there to become a lifestyle coach, even if it doesn't help anyone, it helps you. And by helping yourself, you begin to help other people. I took I found a CE program on the training for diabetes prevention program a couple of years ago. And so I went through the training to become a DPP lifestyle coach. And it's helped me tremendously, even in my practice as a pharmacist and dealing with patients or people coming with prediabetes. Like, there's this resource, there's no need for you to panic. You can certainly make lifestyle changes, and affect yourself. And that's a great starting point for anyone who wants to be a health coach, because it's going to expose you into what that role looks like in sort of like a defined population, but it's going to help you build those skills. So if anyone is looking for a starting point, that's something that I would recommend. And so I'm going to leave you with three things. One, volunteer, become a DPP lifestyle coach for yourself, for continuing education purposes, or even to work in the community that you serve. You can volunteer as a health coach, and that's another way to start building your practice, building your experience, and gaining those hours as a health coach. Second, build up your toolkit as a health coach through continuing education activities. Again, that goes back to what Coach Meg said in her opening speech about continuing education and practice, because that's how you are always going to improve yourself. You don't necessarily have to spend thousands of dollars going out there to get us another certification. If you're a health educator, you can build yourself up with continuing education activities. And that's what we're trying to do here at Pharm PH, provide you guys with different activities to help increase your skills as, in your practice as a health educator, as a health coach, whatever the case may be, but to make some of those activities accessible to you. And finally, if you have a gut feeling that you should level up to health coaching, then go for it. Now is the time. It's a great time. It's a great movement that's out there. And so I encourage anyone who is interested to just, do what you need to do and step into those roles. And so thank you for taking the time to listen to me and tune into the summit. Again, make sure you go to the registration page to claim your CE credits for this activity, for the summit. Some of the instructions will be listed on the registration page. It might take like another week or 2 weeks to get your certificates out to you, but we will certainly get the certificates out. Thank you again. If you liked this summit, which I enjoyed putting together, If you like the summit, want more of it, have comments, feedback, please feel free to send us email, as it will help us in the future to plan for more programs and more activities. Thank you all for tuning in.
The foundation of life itself is our own well-being and health. With a desire to improve, we can achieve the dreams we choose. We've all come together to learn, with passion in our souls that burns. From mental health to nutrition, you have a noble ambition to make the world a better place, teaching others how to create a life of health and well-being, empowered now to see the dream and bring it to reality by showing people how to see the potential within their lives and how to become their own light. You've taken every step you can. You have the knowledge and a plan. With a desire to improve, we can achieve the dreams we choose.